Now, rectal temperature. So this is where I'm teaching about the question I gave. Is the gold standard for core body temperature, the gold standard. It is used in infants and young children. Typically, the rectal temperature is higher than the oral or axillary readings. Now, what's the contraindication? It is contraindicated in neutropenic patients because of the risk of mucosal injury and further infection into the whole body, like sepsis. Now, there's a lag between changes in core body temperature and rectal readings. But the main thing I want you to pick from this slide is that I will not do rectal temperature measurement in a child who is already neutropenic. I will not do that. Now let's go to oral thermometry. It is suitable for older cooperative children, right? Usually it is about 0.6 degrees Celsius lower than rectal temperature due to mouth breathing. And it is affected by the child eating hot and cold liquids. And it can also be affected because of tachypnea. One thing you need to learn about oral thermometry for your board exam, the MCQE one, is that it is not reliable in children less than 4 years because they don't cooperate. So, contraindication for rectal thermometry is neutropenic children. Oral thermometry is not reliable in children who are less than 4 years. These are pearls you need to know for your exam. Okay, what about axillary thermometry? It is the least invasive but least accurate, and its values are consistently lower than the rectal, but the gap is variable. Okay, and so if you have a neutropenic patient or an uncooperative patient, like that child who is less than 4 years, who will not take an oral thermometer, or you have a neutropenic patient, a child who has a form of cancer, therefore you don't want to check the temperature from the bum, the best option will be your axillary temperature. So you see, these are the nuances you need to learn in order to be able to ace your exam.